We are pleased to have Esri and Direct Relief with us today, talking about mobile GIS and data collection for GIS representation of data. Making sure we ask the right questions, get the answers, and make better decisions. Before we introduce the speakers, we just want to go over a few housekeeping slides. We want to make this as interactive as possible, so please open up the chat window in WebEx and watch the traffic there and line up your questions for a 15 minutes or so question and answer session towards the end. We are recording this session today, and we will be sending out a link to that recording as well as the slides being presented to the web page that we have for this webinar on the NetApp Solutions Center. You should expect that come out later today or early tomorrow morning. Feel free to share that with your colleagues and others that might be interested in this topic. We will also present you with a webinar satisfaction poll at the very end of the session today, and we certainly would appreciate you answering a few questions so we can improve this series over time. So without any further ado, I want to introduce Brendan O'Neill. He's a solutions engineer with Esri. He's going to get started and talk to us a little bit about their data collection tool and do some demonstration. Jessica White, she's a research and analysis associate at Direct Relief. She's going to talk about how they're using Esri's tools in Mexico and elsewhere. And Andrew Schroeder, who's an old hat at these NetHope webinars. He is Director of Research and Analysis at Direct Relief as well, and he'll be joining us for the Q&A session. So welcome to all the speakers, and I will turn it over to Brendan. I will try to line up these slides a little bit better for you, Brendan. There we go. So it's over to you.
All right, thanks, Frederick. So today we're going to be talking about mobile GIS. And specifically this process of forming questions, capturing data to get answers for those questions, and then ultimately making better decisions. So what we're going to do today is we'll do a little bit of an introduction to Survey123, just to let you know what it is and how you might be able to create your own surveys. Then we're going to turn it over to Jessica to talk a little bit about their experiences with the application in Mexico City with the Manejando tu Salud project, the Managing Your Health project. And at the end, we'll just very quickly show you how you can take the data that you're capturing and visualize it to make better decisions and monitor your progress as well. So really quickly, just to kind of give you some scope of what we talk about with mobile GIS, at Esri, we have a bunch of different field mobility applications. Some of them, like Explorer, just get your data from the web or your desktops out into the field on mobile devices. There's other applications that can help you do tasking and assigning, workforce order systems. Another application that can help you wayfind two projects in disconnected or connected environments. We had two kind of primary collection tools. One is Collector for ArcGIS, which is more map-based. So imagine you have existing assets in the field, and you need to go out and update information about them or even persist recording observations through time. But then what we're going to be talking about today is Survey123, which is a little bit of a different field application. And it's really centered around this idea of forms, right? So forms are ubiquitous in pretty much all the industries where you need to capture information in a structured way. So when we think about forms, we think of some sort of written document with questions, and then there might be some sort of structured responses, right? That might be a quantitative value, or it might be categorical, where you have to select one of some predefined options. But with Survey123, what we're doing is we're taking that concept of kind of structured data capture from the written world, and we're for turning that into smart forms and these digital smart forms that can be both generated and then consumed through these, or generated through the web and then consumed through the web or mobile applications. So why would you want to use a smart form versus just pen and paper or some other kind of data collection tool? I guess the main underlying reason is that it's just easier and more efficient in the sense that you can record information faster. It saves you time, but also of better quality, right? So as soon as you're doing a transcribing or a translation from one system to another, there's always the opportunity for errors. So we're able to do data validation with drop-downs, these types of things, or maybe just restricting the data type that you're entering into the smart form. We'll show you that. But we can also, in our smart forms, create logic that will actually do computation for us as we collect information. So let's say previously you had to collect two different informations, then you wanted to produce some sort of ratio out of them. You could automatically incorporate that computation, that ratio, into your form so that as you're entering information, it's auto-populating your field. Another great thing is with these applications is that it really shortens your time to having an understanding of your data. So the data flows are open. As soon as you capture your data, theoretically, if you have an internet connection, you can visualize that in real time. If you're working in a disconnected environment, you're limited to when you can sync back to that web environment. But still, it's a drastic improvement over, downloading, extracting, and loading information from one system to the other. And I think from our perspective, all the data that you're capturing is georeferenced, which is a really, really important aspect, right? So regardless of whether you give someone a map view into your collection app, there's always going to be a georeference point associated with the information you're collecting. So when we're thinking about building forms with Survey123, we kind of divide it into three different components of the life cycle. One is asking questions, two, getting answers, three, making decisions. So in the asking questions section, this is really important because with any survey, we don't want to just collect information for no reason. We want to be deliberate. We want to have an understanding of what our outputs are when we're forming the questions that we incorporate into our surveys. Why do we need this information? That's very, very important. But once you've made those decisions, there's two real ways of authoring these surveys in Survey123. The first is super easy. We're going to show that today. It's the Survey123 Web Designer. You can build these forms directly in your browser. It's really easy to get started. You need to have a very minimal technical background to be able to do this. The second way is Survey123 Connect, and this works with a desktop application as well as Microsoft Excel. So it's a free desktop application you can download. If you have Microsoft Excel, you can work with it. And it leverages XLS form specifications. So any of you that have been doing field collection off of XLS forms, it's the same format that's leveraged here in Survey123. And this really allows you the full breadth of capabilities that are available in that XLS form specification. If you don't know what XLS forms the spec is, don't worry, it's really well documented, and we'll show you some resources at the end that can help you get started with that. Just know that the web tool is very easy. It's great for simple tools, but then or for simple surveys. But then if you really need that robust survey capability, you can do that with the XLS forms in Survey123 Connect. So after we've created our forms and we've published them, our surveys, and published them, then there's two ways of accessing those surveys. One is through web forms. So you can generate your survey, publish it out, and share just a URL link, or even embed the survey directly in a web page. And you can do this, you don't need to download any applications. You can actually make these public as well. So you don't need to have an identity to collect data if you're doing some sort of crowdsourcing activity. So web forms are a great way. It doesn't require any extra software. It's an easy way to disseminate your surveys. The other way is using the Survey123 Field app. So this is a free application. It's available on Android devices, iOS, Windows. And this is more, I think of this more from a perspective of like an enumerator who's out in the field, an individual that has to complete many surveys, and you might want to know who's collecting that information, when they're collecting it, et cetera. So collecting information about the collector as well as the individual or the observation that you're collecting information against. And another great thing about the field app is that it leverages your sensors on your phone, right? So you're able to pull in the GPS coordinate from your phone. You're also able to use your camera to record video, to take pictures and associate it with your survey. You can even record audio files as well using the microphone. So you can leverage the sensors from your device by using the field app. Another advantage is you're not limited by your internet connection. So if you're working in remote locations, you can build out your Survey123 in the web builder if you want, and then you can take that survey offline, cache it onto your device, go out into the field for days, weeks, months, and then when you're back in a situation where you have internet connection, then you can sync and push those edits to the cloud. So once you've captured your data, then what do we do? Well, within Survey123 in the environment, there's a whole set of monitoring tools. So as you're collecting in information, you're capturing different points, survey information associated with those points, then it's automatically powering these dashboards. So you get a good view of the progress of your collection activities. You can even integrate these dashboards, these reporting, into PDFs or Word documents. So you can create a direct link from your survey into these docs. So when you print out more written reports, it's automatically embedded in there. You can also filter the data as it comes in depending on different data types, different responses, and download those. There's a lot of great tools there. We're not going to get into these too deep, but I encourage you to take a look at those. I think most importantly, though, is with Survey123, as you're collecting your data, it's immediately available to other applications that you might want to leverage. So maybe you want to do QA, QC on the data that's coming in. You could build a little web app in the web app builder, and someone would have editing access to the data as it comes in, and they can validate whether it's good data or not and make necessary changes. You could also suck that into even just ArcGIS desktop or insights for ArcGIS if you wanted to do some data analysis. We're going to show you today how you can use your Survey123 data in Operations Dashboard. This is great for visualizing your key performance indicators for a specific data collection activity. So you get kind of near-time or real-time operational awareness for what's going on in the field. So this is a really powerful tool. It's really easy to use as well. And then lastly, story maps are a great way of communicating your story once you've collected your information, or maybe after you've analyzed your information, you want to combine your map-based visualizations with text or multimedia, and you can get your story out that way. So there's a lot of great tools that leverage the data that you can collect from Survey123. So why don't we just take a look at what this looks like. I'm going to share my screen, and hopefully you should be able to see my screen now. Looks like you can. So this is the Survey123 webpage. You can get there by going to survey123.arcgis.com. And when you get there, you can log in with your ArcGIS Online identity. So this is my identity from my aid and development organization. So I went ahead and typed in my username and password there. And all the data layers that you generate in Survey123, they automatically populate your ArcGIS Online organization. So if I click on the My Surveys tab, I can see that I have a number of surveys that I've already created. So I can go in here and make changes to the design of these surveys, update them. I can share these surveys with different individuals, whether they're within my organization or outside of my organization, or even the public. I can get into that dashboard and take a look at how my data collection is going, get some good insight into that. And I can also just take a look at the data from a map view, but also a table view, filter that data and export it into local formats, for example, like shape files, Excel spreadsheets, FIO geodatabases, all those types of data formats. But what I want to show you really quickly is how to create a new survey. And we're going to do this very quickly. So I'm just going to call, I have to give it a name. I'm going to call it NetHub Demo. And I'll just do June 14th, 2018. I'm just going to give it a tag. Tags help me discover these items in ArcGIS Online, because what happens is when I create this survey, it's going to spin up a feature layer, the data type that I'm collecting against in the survey, as well as a survey form, which is also an item in ArcGIS Online. So it'll take just a second to do that. If I were to navigate to my ArcGIS Online organization, then I would see that feature layer as well as the form there. So it's kind of doing that on the back end. You don't really need to interact with it, though, if you don't want to. It's quite simple. You don't have to get into the service or anything like that. All right. There it goes. So now I'm in this interactive builder mode to help me create this survey. So we've got a number of different question types that I can incorporate: single text, multiple choice. I can limit it to numbers. I can add a date field. I can allow my survey takers to incorporate an image. There's a lot of different tools there. I'm just going to build a very simple form really quick to kind of show you how easy it is. So I can incorporate a single text line. I want to create a health survey. So I'm going to give it a descriptive title. Then I can go into my single line text. It's all interactive, so I want to add a name field. I can do that. Then I want to add an age field, so I want to limit that to numbers. Change the label. Then I want to add another field that shows the travel time to the closest health facility. Okay, so if I copy that in, I want this to be a multiple choice. Sorry, not a multiple choice, but a drop down. So I have a limited number of options to select. So I can go in here. I'm just going to copy and paste my question into the label. You can see it updates what is this travel time to the closest health facility. Then I can add my different choices here, right? I can go less than 20 minutes or maybe more than 20 minutes. But one of my favorite features is this batch edit feature. So if you have your options maybe in a Word document or a spreadsheet, you can just copy them and then paste them into the batch edit form, and it's gonna pre-populate all those options. Okay. So there are a number of different questions that you can incorporate directly in the web form. As I mentioned, Survey123 Connect gives you a little bit more robust capabilities. But if you want to just do a simple form, this web builder works great. I'm not going to go through configuring the rest of this form, but just know that after I've configured with all my different questions I want to incorporate, I click Save, and then I can publish that out. And as soon as it's published, it's available for me to consume either in a web form or in the Survey123 collection app. So I've got that filled out here. This is the web form that I was just about to create, so I could add in my name, the age. We notice that if I'm trying to type a letter here, but it's saying, you know, you can't do that. You need to add a number. So I can add a number. You get the idea. We go through. I can even add a signature and submit this form. And immediately, the data that I've captured in that form is available through a web map that I can incorporate into a dashboard or other types of applications. So we're going to show you this a little bit later, how you can work with the data that you capture directly in the web. But really what I wanted to show you here is just that it's really easy to create a Survey123 survey through the web builder tool. I just want to let you know as well that the XLS form is available through Survey123 Connect. But we're not going to spend too much time on this right now. What I'd rather do is turn things over to Jessica so she can talk to you a little bit about how they use Survey123 to work with this Manejando tu Salud project and their partners down in Mexico City. So we'll get back to kind of the results, how you would work with Survey123 data at the end of the webinar.
Great, thank you, Brandon. So first I'd like to talk to you a little bit about the program of the Manejando tu Salud program. And so throughout Mexico City and in the surrounding areas, there are underserved communities that do not have access to health care. Some of these folks might not have access to specialized care, such as pediatric oncology, while still others lack access to even the most basic preventative health maintenance check-ins. This can be due to several factors, such as gaps in affordable healthcare services or difficulty navigating these services, or the location where they live does not provide specialized examinations or diagnostic tests, or it could be that an individual has a serious disease and has temporarily come to the capital city to find specialized care, but lacks the financial resources for transportation even if the medical care was provided at no charge. So for these people, the Manejando tu Salud, or Driving Your Health program, was created by Direct Relief, providing free healthcare screenings and services with funding from the Baxter International Foundation. So the aims of the program Manejando tu Salud, or Driving Your Health, are to promote greater health, build capacity, and fulfill gaps experienced by the local implementing partners. The program plans to accomplish these endeavors by transporting medical teams to communities with limited healthcare access for complementary health screenings, providing transport to underserved patients to their needed specialized medical facilities, and by supporting specialty training of local healthcare workers. The 3-year program has the goal of benefiting 40,000 patients with direct healthcare services and 310,000 individuals with indirect health services, whether that be through health education or prevention and awareness training. So I'm happy to say that the program has been successful by many measures, including hitting its target on direct beneficiaries. So far, the program has helped 48,361 individuals directly and another 255,570 individuals indirectly. How did the program accomplish this? Well, by partnering with 4 prominent charities based in Mexico City: Asociación Gilberto, Casa de la Amistad, the Mexican Association of Diabetes, and the Order of Malta. Before we talk about our use of Survey123, I'd like to tell you a little bit more about our program partners, their program objectives, and their need for mobile medical surveys. So first, Asociación Gilberto. Asociación Gilberto's program objectives are to provide healthcare screenings to underserved school children that lack access to these services. During health screening events, Asociación Gilberto refers any patients that require follow-up care to nearby hospitals where they have agreements. They provide 4 different types of health screenings at local schools, namely respiratory, pre-diabetes, optometry, and dentistry. The surveys we created for Asociación Gilberto focus on the observations and diagnoses made by health practitioners at these events. For Casa de la Amistad, which is translated to the House of Friendship, their program objective is to provide better access to cancer hospitals located in Mexico City area to pediatric cancer patients in a specially outfitted bus. Additionally, Casa de la Amistad is creating better public awareness of pediatric cancer by holding free cancer detection screenings with educational components and by training local health professionals in early cancer detection. The surveys created for CDLA, or Casa de la Amistad, were to track if the children attending the cancer screening campaigns exhibited any early warning signs of cancer. For the Mexican Association of Diabetes, their program objective is to train local healthcare workers on diabetes prevention, detection, and treatment, as well as general healthy lifestyles and good nutrition. The Mexican Association of Diabetes is also providing pre-diabetes campaigns. Surveys created for the Mexican Association of Diabetes tracked lifestyle factors that contribute to the disease, as well as the campaign attendees' knowledge of the disease. Additional surveys were also created to measure the healthcare workers' level of knowledge on diabetes both before and after their training. Finally, Order of Malta. For Order of Malta, their program objective is to provide healthcare screenings to underserved individuals that lack access to these services. The program refers any patients that require follow-up care to nearby hospitals where they have agreements. So the surveys created for Order of Malta focus on the diagnoses made at the event, as well as measuring the attendee satisfaction with the services they received at the campaign. So those are our program partners, and as we've discussed, the approaches taken by these program partners are very different. The indicators they track and measure are varied, and the focuses of the events they hold are different. Likewise, their comfort level of interacting with technology is also very different. The range of technological intelligence that the partners have falls within a wide range, with some not feeling comfortable engaging with technology to others that are technologically pretty far along. Regardless of whether the partner falls, where the partner falls, on the range of technological literacy, we wanted a mechanism that could build up the partner's capacity to track and measure the indicators important to their objectives. So to do this, we turned to Survey123. And we went to Survey123 because we wanted something that was easy to set up and easy to use, and that gave us the flexibility to create both simple and sophisticated surveys. We wanted something that was easy to distribute to a number of partners and that was easy for our partners to use in the field. We also wanted something that was easily integrated into ArcGIS. So Survey123 fit the bill in all of these respects. So to use Survey123, we went ahead and authored the surveys in the Survey123 Connect application and published them to ArcGIS. Surveys were then shared with the partners in Mexico City and downloaded onto their tablets with the Survey123 app. The partners then took the tablets with these surveys on them out into the field. Since there was no Wi-Fi at these events, the data collected at the campaigns was stored on the mobile devices and then pushed online when the partners returned to their offices. We were able to create smart forms that were available in both English and in Spanish. The surveys that we built ranged in simplicity from very simple to quite sophisticated and had built-in logic so that they could have question skip logic or be pre-populated with attendee data, collect location information, and also collect signatures. Also, since the survey with pre-populated data had sensitive information, it was password protected so that only the people that needed to access it could do so. Once the data was uploaded into ArcGIS, the team at Direct Release was also able to access the data in both tabular and mapped formats. So since we talked about the program, we talked about our implementing partners and the data that was collected, I'd like to talk about our experience in using Survey123. For me, Survey123's usage in this program had both pros and cons. On the con side, we saw a couple of challenges. To note, this isn't a typical Survey123 implementation. Typically, organizations will create their own forms in Survey123 to go out into the field and collect their own data. For this particular case study, we were creating the surveys as a data collection tool and then distributing them out to our 4 program partners. So this was a more hands-off approach to data collection and had the challenges that you would expect with a mechanism such as that. One of those challenges was that there was a language barrier present, as many of our partners in Mexico City don't speak English, and my Spanish is fairly basic and can best be described as entertaining. Another challenge is the fact that it is a remote working relationship. Culturally, work happens in Mexico City face-to-face, which makes trying to get work done on the phone through an interpreter all the more challenging. Also, the partners that are not so technologically savvy were reluctant to embrace new technology, as to them, the paper and pencil work fine, so the effort to try and learn a new foreign technological tool is not minimal. So finally, there was some confusion as well on the offline data collection capacity and how to upload the data when the campaigns were finished. On the pro side, however, of using Survey123 for this project, we had a lot of triumphs. Namely, the partners started asking better questions about the data they were collecting. In that way, we saw the partners build their capacity to better serve the patient population that they're providing services for. When you have someone who's never before used an online survey ask a question on geographical trends of a diagnosis, you know it's a good day. The benefit for us to be able to easily share data back and forth with our partners, both in a map and in tabular form, was very beneficial, as was the ability to share the mapped data back to our program funder. To note, one of our partners independently started her own mapping project, where she took the lat-longs from the data collected in Survey123 and made a map to start tracking the campaign locations to share within her organization. You can see her at the bottom photo here, proud of her mapping efforts, and to me, that was another good day. The other photo shown here is a picture of a nun that was trained in survey administration, showing off her newfound skills to a colleague, which was another highlight for me. So while we talked then about tracking various programs and the number of patients that have benefited from these programs, and how all of this is very helpful, we also wanted to capture the most important part of the program, namely the stories of the people that the program is serving. So to do this, we created a story map in Esri's ArcGIS Online that highlights narratives both of the beneficiaries of the program and those that volunteered their time and expertise to make the campaign successful. We created a story map tour to explore stories from several individuals over the past 2 years, and these story maps are available in both English and Spanish. The story maps are great as they are easy to use, don't require coding, and can convey powerful narratives while providing a geographical component. The links to these story maps can be found in these slides, which will be shared after the presentation, or by Googling Driving Your Health Direct Relief. So now I would like to turn it back over to Brendan to talk a bit about displaying the survey data that we've collected.
Great, thanks Jessica. So let's do a little screen share as well. Let's see, share my monitor, there we go. Okay, so what we're looking at here is a web map that is pulling in the Survey123 data that has been collected for the Malta campaign. Okay, so it's not very interesting, I'd say. I mean, it could be interesting in the sense that we know where the mobile health centers were, and we also get an idea of the number of patients that were seen at these mobile health clinics through the symbology of the map. What I've done here is just, I've enabled clustering on this web map, so it's basically grouping all the coincident points into these points. And if I click on them, I can get the number of points per location, and then I can browse the individual features if I want. So I have full access to the locations of the information collected from the survey, as well as the data. So the data table that we're seeing here is cleaned up a little bit in the sense that I'm not showing some of the sensitive information that was collected. I'm only displaying the information that is necessary for the dashboard that I'm eventually going to create. So we have a few fields here. We have the campaign date, the age, gender, diagnosis, etc. That we have access to. So we have access to the location as well as the survey information that we've collected. But this is great, but I know I can do a lot more if I incorporate this into a web application, specifically a dashboard. So I've configured my web map, and if I share this web map out, I have the ability to create different types of web applications. We have set configurable applications. Jessica mentioned those story maps. These are all the story map templates that you could use, so you can incorporate this web map directly into some sort of narrative to tell that qualitative aspect of your story. We can also incorporate the map into a web app builder application. Remember, if I wanted to do QA/QC, for example, on my surveys coming in, I could create an editing app with web app builder. But what we're going to work with today is this operations dashboard, which is another type of configurable application template. And I'm just going to show you really quickly what it looks like from the builder mode of operations dashboard. Then we'll jump into a finished product. Okay, so generally the operations dashboard, we start with a map, right? We're a geospatial information systems company. We love maps. We think that maps should be in most of our applications. So I start with my map. Again, I'm able to select my features just like I did in my web map, and I can browse individual features if I want to. But there's a lot of there have been a lot of surveys that have been collected, close to 4,000 for this campaign. How do I make sense out of that? How do I get aggregated or consolidated information from a lot of different data points? I can do that by adding different elements that will pull in that attribute information and give me a nice clean look at my data. So for example, if I wanted to, I could create a pie chart and pull in the data from my survey, and then I can choose a field that I want to display on. So let's say I wanted to get a breakdown of my travel times to closest health facilities. So there, I get a preview of what my pie chart is going to look like, and I get a breakdown from all my survey takers, the 4,000 survey takers, and how long it takes them to get to health facilities normally outside of this mobile health campaign event. So I can go into my chart and there's a lot of different configuration options. We could do an entire webinar on Survey123, on the operations dashboard. I can make changes to the color. I can give it a name and perform different actions based on selecting this chart. Just know that you can add all these different elements to your dashboard, okay? And it's really easy. So imagine you're collecting your data in the field with Survey123, and as your data is updating in the map in real time, you're not only getting an update to the data that's visualized on the map, but also to your key performance indicators in the different data elements in your dashboard. That's kind of an important concept, right? The data flowing directly from the field into dashboards that you've already configured. And to take a look at what one of these would look like when it's complete is this dashboard that I created. I've experience with operations dashboard, but this particular dashboard probably took me 30 minutes to an hour to configure. So really the hard part is the data collection. That's the time-intensive, resource-intensive component. But once you've made that investment, it's very easy to create information products like this off of it. And what we've got is a number that's being driven by the data, the number of patients that have been seen. We also have a breakdown of those who have reported that their normal health care is very good. Those that have reported that it's very poor. So this is determined based on the whole data set. We also have that same chart that I created, the pie chart, with the time to closest facility. I can blow that up. We can get a breakdown of the different, a breakdown of these travel times. I can also get an idea of the perception of the campaign. So they're doing pretty well, right? We have 65% nearly that are saying that this mobile health campaign is great. We have a very small sliver, less than 0.01%, who think it's doing very poor. But if you're out in the field and you have a campaign going on, as the campaign's going, you can see in this dashboard how it's being perceived and potentially update your activities based on what you're seeing here. We also just have a breakdown of the reason that people are visiting these mobile health centers. So prevention is the highest percentage, was 51%, but then we have other ailments that people are coming to seek attention for. We also have the desired frequency here in this serial bar chart at the bottom. It seems that there's great demand for these activities. People want to see these every month in their communities versus every 2 months, every 6 months here. So it's great to kind of consolidate and aggregate the information so you get a look into your data that's impactful for you, that's meaningful for you. But you also have the ability to interrogate the data and filter it. So I could filter based on date, for example, but I can also filter on location. So let's say I'm just interested in the information for this area in eastern Mexico City. I can draw an area of interest, and it's going to update all of my dashboard elements here. So here we can see there's relatively less people who have very poor health care. You can see total patients is going to remain the same because that's a global indicator, but it'll change depending on the other elements will change depending on my selection, right? So we get an update of the desired frequency if I go into normal healthcare, and we can see how those widgets update. Okay, so that's kind of what I wanted to show you is, we're not just collecting data with Survey123 or any other application for the sake of capturing data. We do it for a reason. We want to understand the progress of our campaigns. We want to understand the beneficiaries who we're serving. We want to understand how our operations are going so that we can adapt, we can learn, and we can plan better campaigns in the future. And I think another key component is we also want to be able to communicate these results either internally to get more buy-in or also to other stakeholders like donors or funders. So this whole dashboard could very easily be embedded in your website. It could be embedded in a story map. It could stand alone. So there's a number of different ways to leverage your data with Survey123. That's kind of the first part. It's almost the hardest part. It's the most time-intensive part. But once you've done that, there are a number of different ways you can use it to ultimately make a bigger impact with what you're doing. All right, so with that, maybe we can turn over to a little bit of Q&A. As Jessica mentioned, we're going to be distributing the slides as well as some resource slides as a PDF after the webinar and an email. So there'll be some resources for how you can get started and also learn more about the campaign that the Direct Relief has been carrying out down in Mexico City with their partners. But maybe we can switch over to questions now.
Excellent. Well, thank you very much, Brendan and Jessica, for an information-packed session here. We have about 15 minutes or so to address some questions, and quite a few have come in. So I'm going to start from the top and work myself through the list. Brendan, the first one I think was for you. You mentioned that you mentioned early on some task assignment capabilities. Is that built into Survey123 or the tool, or let's say a field worker is supposed to conduct a set list of surveys? Can that be pre-populated?
That's a great question. So the answer is it's not done directly through Survey123. Survey123 is the focused app for collection. However, the other app from that first slide on field mobility called Workforce, it works with a dispatcher field worker kind of architecture where you can generate those tasks in Workforce and assign them to your field workers and workforce is integrated with Survey123, right? So they'll get the task on their mobile device. They'll select a button in Workforce, and that will automatically open up Survey123 in the specified location where they need to do their collection activities. So the answer is it's not built into Survey123, but the capability is integrated with Survey123.
So you just combine this suite of applications on the smartphone or your tablet.
Exactly.
Excellent. The next question was, can Survey123 be embedded into a social media platform like Facebook or Twitter?
Definitely. So there's a number of different ways you can do that. If you just want to have the web forms for someone to collect information, you can get the embed code directly from the Survey123 website. So it'll give you a little HTML snippet. You can just copy that and paste it into anything that's HTML enabled. So yes, you could definitely do that in Facebook, Twitter. Twitter, you might think about more the URL for the form, where you have the URL, you blast it on Twitter, people open it up, it'll open up directly in their browser, so it's kind of a link. So there's either embedding the full form, if you're anticipating people using tablets or even mobile devices, but they're looking at more of a web content versus links as well. Sorry, not versus, but links as well. So you can have full forms and links out to the full forms.
Excellent, thank you. I'm going to jump down and ask a question that was directed at Jessica, I believe. Jessica, how many different survey takers did Direct Relief engage, and what did you need to do relative to training of them?
Great, thank you. So I believe that we have engaged a bit over 8,000 of survey takers between the 4 partners. And relative to training, then what we did was spent some time with each of the partners, getting these surveys uploaded onto their tablets through the Survey123 app, and then having a couple of test runs with them. And, speaking back to the partners' different familiarity with technology, some of these trainings were, very quick and straightforward, and then others were just, sitting down with them with the survey on the tablet and showing them that it is pretty straightforward, and you can't break it, right? I mean, you can make edits to the data if it's, improperly collected, and so there are ways of going about things, and it's not as scary as it might initially seem.
Just a follow-up question to that, or 2 quick questions. Are you exclusively using tablets, or are you also using smartphones or even PCs for the data collection?
That's a great question. So for the campaigns themselves, we relied exclusively on tablets. And then for the trainings that were done by some of our partners, we did have before and after surveys to gauge the attendees' knowledge levels. And so those links then were sent out via URL. One of the great things about Survey123, as Brendan mentioned, is that you can use it on your smartphone, on a tablet, or on the PC. So for our purposes, we relied on both the tablets and the PCs.
Excellent. And would you say that your survey takers had a certain level of kind of digital set of skills before you started, and that was the assumption here, or did you start out with from scratch where people did not have much technical skills at all?
It was definitely a mix, and that was one of the interesting things about this program, is that you were working with a number of different people at different levels. And for each of those, we were able to train them in how to use Survey123. So it was definitely a success in that regard.
Sounds like this is quite an easy-to-use platform, so that's excellent. Thank you very much, Jessica. There's a few other questions. I'll move back to the list. So, Brendan, what distinguishes Survey123 from similar systems available in the market? There's a bunch of questions along this line. These lines, if you can compare it to ODK or other types of solutions.
Yeah, that's a good question. I'd say probably the biggest advantage to Survey123 out of similar form-based or XLS form specification tools is its integration with with the other tools on our platform. So the time to dashboards, to story maps, to other applications, to analysis is just streamlined, right? You don't have the connection there. We're also pushing into new territory. I'd say the integration with the workforce is a big one. We're also, in the next release of Survey123, where it's in beta now, we're integrating new technology for incorporating webhooks. So what this does with webhooks is, say you take a survey and there's a specific question that triggers something high priority. So maybe there's a hazard or something along those lines. Imagine taking your survey as it's submitted to Survey123, it sends an email notification or an SMS notification to someone saying, this needs our attention very quickly. Or in the scenario of like a low priority, let's say there's some sort of asset in the field that's not working, but it's not hazardous to someone's health, or it needs to get fixed, but not right now. Then you can pre-populate a Google Sheet, for example, automatically, not pre-populate, but automatically populate a Google Sheet using these webhook technologies. So there's integration with our platform, the ArcGIS platform, but also we're building out integration to other platforms like Microsoft 365, Evernote, Google Sheets, Salesforce. So I guess the short answer is the core capabilities that you see in like ODK, Kobo, that kind of thing with XLS form specifications, that's the same as in Survey123, but we're really trying to take that technology and push it into new areas by integrating with dashboarding, web storytelling tools, as well as other external tools like BI tools, for example.
Yeah, there were a couple questions along those other tool, other platform integration, like can I connect ArcGIS data up to Tableau or Power BI, and also could other data collection tools feed into the ArcGIS store?
Yeah, those are really great questions. So on the integration with BI tools, so right now if you go to Microsoft Power BI and you click on the mapping function, that's all Esri maps, that's all ArcGIS maps. So bringing in your spreadsheets and things like that to Power BI and then mapping them, you're taking advantage of the base maps and things like that. That's kind of like just a standard tool in Power BI, but it doesn't get at that point of integrating your ArcGIS data into Power BI. That you are able to do as well. I think the subscription is like $5 a month for that. And what that allows you to do is bring in, say, your Survey123 data that you're collecting and directly pull that into your Power BI dashboards. So it creates that connection between ArcGIS Online and Power BI. So there's that integration with BI tools. There's also another tool called ArcGIS for Adobe Creative Cloud. So if you're working kind of design, cartography, communications, you could also leverage the data being pulled in from ArcGIS, say brought in from Survey123, directly into the Adobe suite, so you can kind of create those high-end map products. So as far as integration from other tools, other survey tools into ArcGIS, there's a couple of ways to do that. One is something we call ETL. So as long as the data that is collected in that environment is open, in the sense that you can pull it out, you can extract it, transform it, and load it into ArcGIS Online. So kind of pull it down, download it, and then publish it into ArcGIS. The other thing that you could do is if you have your survey that's built on an XLS form that was built for, say, Kobo or ODK, that same form you can use in Survey123 Connect to build your surveys in ArcGIS with Survey123. I just did that this week. I took a couple Kobo forms and kind of built them out, prototyped them out in Survey123. So you can leverage the forms you've already created, and then the data that you're collecting, whether it's extracted and loaded or just collected directly in Survey123, that integrates well with say, Power BI and other BI tools.
Excellent. There was another question along these lines that said, can the data collected by Survey123 be redirected to different storage facility as they come in?
Okay. So I'm not exactly sure what that question is getting at, but I can take a guess. So for example, if you say you're maintaining your data in a database, Postgres or SQL, Oracle, is there a way to kind of collect data through Survey123 directly to those databases versus, say, using ArcGIS online and our hosted data that's in our cloud? If that's the question, then the answer is yes. You can create services that reference the data wherever it lies, your databases, and then you can use Survey123 and those services to write data directly to your databases that are kind of outside of our system. So essentially, we're creating a connector to those databases, and Survey123 acts as the tool that allows you to collect information and write to that database.
Great. It sounds like there's a lot of technical questions here, and I want to end with a question to Jessica, give her kind of the last word. Jessica, you discussed sharing information with on-the-ground partners. Do you have any examples of how this data or the results of this was actually shared all the way back to survey takers?
So the survey takers themselves, so those folks that are actually out in the field collecting the survey responses, they were able to see the data. To the patients that they were collecting the data from, not so much, but the data that the survey collectors did take in, they were able to see.
It is a little bit of a classic survey or data collection issue with the fact that you're asking all these survey takers to day in, day out record the information, and sometimes we fail to kind of go back to them and say, well, this is the kind of impact you're having. So maybe somehow making sure that feedback loop is completed might also motivate survey takers to be more participatory. Not that I'm suggesting they're not, but it's an important aspect, I think, of making sure that people understand what they're contributing to overall. Well,
definitely.
we're at the top of the hour.
Too, oh, sorry.
Go ahead, Jessica, please.
Oh, just that it was very beneficial for me to be able to visit one of these campaigns and see firsthand the surveys being taken, and to see kind of that engagement with the patient populations from the survey takers themselves, and able to absolutely talk to the survey takers and got feedback on what would improve the surveys that they're giving and streamline that work process. So thank you.
Fantastic. Well, thank you both for an excellent session here. I also want to thank the audience for a bunch of very, very insightful questions. And since we're now at the top of the hour, we'll finish up. Please spend 2 minutes answering the survey questions that you'll see pop up on your screen when you leave today. So thanks, everyone. Have a great rest of your day. Morning, afternoon, evening, wherever you might be. We'll be back in touch soon. Take care. Bye-bye.